So, what is GERD? According to the Montreal definition, the international gold standard for defining and grading GERD, GERD is a condition which develops when the reflux of stomach contents causes troublesome symptoms and/or complications. Reflux of the stomach is when the stomach content backs up into the esophagus. A certain degree of reflux is normal and occurs in short-lived episodes after meals, and often without lasting effects. This is termed gastroesophageal reflux, more commonly known as acid reflux. Some people with acid reflux have described symptoms of sour taste, regurgitating food, or heartburn, but these symptoms are episodic. Acid reflux becomes GERD when symptoms are troublesome or damage to the mucosa of the esophagus occurs because of the acidity of the refluxed stomach contents. The symptoms of GERD typically occur more than twice per week and include frequent heartburn, commonly called acid indigestion, and often described as a burning sensation behind the breastbone, and regurgitation, which is the perception of flow of refluxed gastric content into the mouth, or hypopharynx. There are other esophageal disorders with similar presentations to GERD. These disorders include infectious esophagitis, which is caused by a bacterial or viral infection, pill esophagitis, which is when a pill becomes lodged in the esophagus and slowly dissolves, corroding the skin, eosinophilic esophagitis, an inflammation of the esophagus caused by an immune reaction to foods, allergens, or acid, peptic ulcer disease, sores in the stomach and small intestine, and non-ulcer dyspepsia, a functional gastrointestinal disorder without any known cause. Because all of these disorders have similar symptoms, diagnostic testing is the only way to differentiate them. The prevalence of GERD among Americans is estimated at between 18.1% to 27.8% and is on the rise. In 2004, GERD was the most frequent digestive reason for ambulatory visits in the United States, with 6 out of every 100 visits for GERD-related issues. Incidence of GERD has been steadily rising since the mid-1970s, partially due to the better technology to diagnose the disease. However, it may also be due to other factors inherent in society, such as changes in diet and the obesity epidemic. In fact, some of the risk factors for GERD include obesity, hiatal hernia, and pregnancy, all conditions related to increased abdominal girth. Other risk factors for GERD include smoking, dry mouth, asthma, diabetes, delayed stomach emptying, and connective tissue disorders. We will discuss how these issues relate to GERD throughout this course. GERD treatment represents a huge expenditure. GERD is the most common gastrointestinal diagnosis in American medicine, resulting in nearly 9 million provider visits per year.